Good morning, everyone. Welcome to Health Consumers Queensland's second webcast. We will just give everyone a moment or two to join us. We're expecting quite a few attendees. Welcome from wherever you're joining us from across Queensland. I'll wait until people joining slows down a little bit and then we'll kick off. We've got over 300 people registered to join us this morning, so we will just give it a moment. And we will be recording today and sharing it online for those of you who can't stay for the whole time or who might like to share it. Starting to see some welcomes and some hellos in the chat. Okay, all right, well, we might kick off. Fantastic. Well, as I said, welcome everyone to Health Consumers Queensland's second webcast. My name's Melissa Fox. I'm CEO of Health Consumers Queensland, and I'm very delighted to be hosting a very, very special session today. Firstly, I'll start by acknowledging the traditional owners of the land on which I am today, the Yuggera and the Turrbal people, and pay my respects to elders past, present and emerging, and acknowledge that sovereignty of this land was never ceded. So we are recording, but people's cameras obviously aren't on. And we do have the ability for you to pop comments and questions in the chat. So I encourage you to do so. So this series, our new series of online events, is to help you and your communities prepare for a possible surge in community cases. As borders open today, here in Queensland, modelling shows that we can anticipate an increase in infections. So we hope that we can bring you information that will help you to do what you can now to prepare. And planning and preparation is something that we Queenslanders do every storm season when flooding is on its way, and we're used to preparing for the worst that weather throws at us. It reminds us of our resiliency as a state. And we have the expectation that everyone in our community is looked after and kept safe. And therefore, preparing for COVID-19 is a natural thing for us to do and something that most Queenslanders want to do. And we hope that these webinars help you as you prepare yourselves and your family. So thanks to those of you who submitted questions when you registered. We received about 30, and this morning I will lead a discussion with our special guests, attempting to answer as many of these as we can. If you have any others, please pop them in the comment box and we will answer as many as we can. So for those of you who haven't attended one of our events before or may not have heard of us before, Health Consumers Queensland is Queensland's peak health consumer body. We bring together patients, carers, members of the community with the health system. So with the health department, with public and private hospitals, with GPs, with primary care, with allied health professionals, with professional organisations to come together to design the best possible health system for people. And we've been doing a lot of that during the pandemic response. We had over 40 online consumer conversations during the pandemic. Some of you would have attended those, where we heard from a diverse range of Queensland health system users about what was working and what wasn't during the pandemic. We summarised these into issues papers and shared them with key decision makers and consumer reps to help them make the response as person-centred as possible. So this new format, we're inviting guests to give informative updates and then following up with the Q&A during our session. We can pop the link into the chat to the video of our first session that we held the week before last with Dr. Alexandra Markwell from the Queensland Clinical Senate. And we also had a 2-page summary of the key points out of that session that we can pop in the chat as well. We have extended our invitations beyond users of the health system for these sessions to members of the broader community. And we're also aware that there are many people who work in the health system online today. You need to be as prepared as us for what is to come, as those who will be providing care to us, and also as users and carers yourselves. So thank you for all that you have been doing during the response, and for our partnerships together, consumers and the health system partnerships are strong. So on to our special session for today. So fortunately, not many Queenslanders know what it's like to have COVID. As we start to see community cases grow now that our border has opened, it's important that we're prepared for what to expect if we or our loved ones are diagnosed with COVID-19. And so today I would like to welcome Dr. Krispin Hajkowicz and his 13-year-old son, Tommy. We're really grateful for you both being here today. So Krispin, I'll start with a question for you. So I first met you about 2, maybe 3 months ago at a Delta Preparedness forum, which started my thoughts on storm planning, that whole session. You were there in your role as Director of COVID and Infectious Diseases at the Royal. And you were the first person that Professor Keith McNeill, the Chief Information Officer of Queensland Health, threw to during the scenario testing workshop that afternoon. We were given a hypothetical example of a man who had tested positive. And I was really struck that your first question was wanting to know if the man was okay after the shock of being diagnosed. And my consumer spidey senses were up, and I beelined for you after the session to find out why you had asked that. And what you shared with me made me realise that you understand COVID-19 as few Queenslanders can. Can you start by telling us when you first heard about COVID-19 and what you expected might unfold?
Yeah, sure. Thanks, Melissa. Lovely to see so many people online and many familiar names. It's really pleased to join it, and thank you very much, Tommy, for joining in the session as well, giving up precious minutes of your school holidays to come in today. Look, I've had an exceptionally personal experience with COVID. It feels like sometimes it's been personally directed at me, but that's not actually true. So we were actually on holiday when COVID first hit. We were enjoying a summer holiday, and I just started reading some articles in the lay press, like you all would have been, just noticing there was a bit of kind of initial concern. We were in Fiji, I think, when it very first broke, having a lovely summer holiday. Just started to notice that things were maybe not all okay with this new virus. Because to be frank, in the profession, lots of people from public health, we know that there are new viruses emerging all the time. And so there are lots of sort of false negatives. There are lots of like little warnings, there's avian flu and this sort of stuff. But just these little radar signals started ticking off a little bit. And it's a bit funny. Normally, some of the countries where this was unfolding are pretty quiet about releasing information and that sort of stuff. And then you started seeing the mortality coming in. So that just started getting me a little bit worried. But by January, when things really got going, it clearly was something pretty badly wrong. And you could tell that, I think probably that the two key things that got me really alarmed was when it looked like it was much more apparent by mid-January that was very strong human-to-human transmission, and that really got things ticking off. And I think probably the worst of all is when the cases started popping up in Italy for the first time, and then you suddenly realised that this was a pandemic, and it had spread not only from a country to another country, but a whole different continent, and things got a bit out of control. So that was the beginning of last year. And by February, you could see that, February, early March, you could see that things were really getting a bit out of control.
Yeah, absolutely. And what about you, Tommy? Were you paying much attention to what was in the news when you were on holidays, or no? probably saying, why are you talking about work, Dad?
Yeah, that's right.
What did your role, Crispin, end up being during the first 18 months of the pandemic, and how was that different to your work as an infectious diseases specialist and leader
So,
prior?
I'm one small part of a massive cog at rural Brisbane and in Queensland Health, but we're one of the sort of frontline hospitals and played obviously a very major role in the in preparation for what was coming and where to from there. We were on leave, as I mentioned, but we came back from holidays. The other members of the team had done an outstanding job. And then really those early days were very much focused on getting the right PPE and really just trying to understand how the virus was transmitted. It was pretty scary at that stage. Obviously, we didn't know about the transmission. We didn't really know about the mortality. We had no drug treatments, obviously no vaccines. And in fact, not only were there no vaccines, it wasn't even clear, remember, at that stage whether vaccines would even work or not. We didn't know that it would be possible. There had been animal coronavirus vaccines before, but no human vaccines. And so those early months were exceptionally complex, difficult. There was a huge amount of fear. There was a very reasonable, understandable fear in healthcare workers about contracting and dying from COVID, and also contracting and infecting one's family. That was a huge focus. And then that sort of early Queensland miracle happened where the wave didn't break, which is incredible and outstanding from the public health and bureaucratic responses to COVID. So then for the next 18 months, we've really primarily been in a preparation phase, really taking data from overseas and then from Victoria, then from New South Wales, and then Victoria again, and other jurisdictions where things have really been much more challenging, and trying to get the system as well prepared as we possibly can for COVID. So that also includes things like introducing new treatments. There was remdesivir and then dexamethasone, wonderful, amazing drug. And now we're looking at the monoclonal antibodies and a few of the other new treatments and making sure we could deploy them. And then the absolute game changer was obviously the vaccines in a good way, which the clinical trials started reporting in November last year, and by December, and we have started getting access to those by February, March of this year. I guess that the other bad thing that happened was in December, January is when the new variant started hitting. That was probably I think my lowest week of the whole pandemic would have been Christmas last year, when the Alpha variant started popping up in Brisbane, and we had the first cases at rural Brisbane in Queensland, and you suddenly realised there was still some hope at that point we might be able to eliminate COVID and it might just go away. And it became very clear from December last year that there was we're going to be living this for the rest of our lives. It was not going away. This was an endemic virus, and it was going to keep on mutating until everyone had been infected with it, basically. And so that was probably the absolute low point, I think, was Christmas, New Year, some very difficult patient situations we had with the new Alpha variants coming in from the UK. And then obviously then Beta came from South Africa, and then Delta, and now we've got another one for the Omicron as well.
Yeah, which we'll absolutely get to and get your perspective about what that means for us moving forward. Can we shift forward to August, and can you explain what unfolded for you and your family in August of this year?
Yeah. So we had a pretty normal week. The last week of July, first week of August, wasn't it? Just after Tommy's birthday. Doing all our normal family activities. Obviously, one thing I was going to say is that, of course, there are lots of healthcare workers online, and we're healthcare workers, but we're all consumers as well, obviously. And we had a pretty normal week, but just on that Friday night when the schools cluster started up, we were a little bit worried, weren't we? And we were aware that a few of Tommy's classmates and soccer team friends might have been exposed, so we were quite worried about him being exposed to COVID on the Friday night. And we had a few people over for dinner that night and things, and it was all kind of okay. But then by Saturday, there were many more cases. Early Saturday, I really had a gut feeling that something was very, very wrong. So we decided to go into quarantine a little bit early before the lockdown came on Saturday morning, which was a good call because we would have taken out 2 football clubs and probably a few thousand people if we hadn't, but we stayed at home that day. And by Saturday evening, it was very clear there was a big problem going on. Tommy was well at that stage through Saturday and Sunday. You were well, I think. And on Monday, we woke up and knew that everyone at the school had to get a test. And so my wife, Sarah, took Tommy off to get a test and went to the Rural Brisbane and queued up for about...
No, we went to
there was a too big a queue, so then you drove on to Rural Brisbane. Yeah, but then you really had to get through it. Yeah, so he was well at this point. We were just doing it as a screening test. And then she went to Rural Brisbane and then queued for a little while there. And then luckily Sarah drove straight home. We had a brief call about whether she could just drop at the pharmacy and get some Nurofen on the way home, and we decided not to, which turned out to be a good call. And then about 3:30 that afternoon, I got a slightly concerning text message saying, public health were going to be in touch with me. And about 4 o'clock that afternoon, I got a call from a friend and public health doctor saying, I just wondered if Thomas Hajkowicz is related to you. And they told me the positive result. And, it was a pretty amazing day in my life, really. I guess I've had this singular professional focus on COVID. We'd been extremely worried that Sarah and I would bring COVID home from work and infect the boys. And there was this total 180-degree frame shift the other way, where suddenly it had all flipped on its head. And it was a bit overwhelming. I cried. I was quite emotional. I came downstairs and told Sarah. We were really upset. Tommy wasn't actually, you weren't sick right at that point, I don't think. I'll throw to you in a moment. But, and so as I thought about this over the last few months, what happened was there was this COVID out here. It's this massive global issue, and the PPE and the treatment and stuff. And it just brought it straight down to this single point, which was your beautiful, lovely child sitting on the couch with Delta variant COVID. And it just suddenly brought it all into clear focus about what was actually important, what the pandemic actually was. It was a bunch of individuals getting infected with a virus at the end of the day. And I was really worried. I was just scared. I was scared as a father. I everyone did their best for the medical confidentiality thing, but I did start, the text messages started piling in. And I switched my phone off. I didn't really want to talk to anyone. And I was just really worried, actually. I knew we had a bad few days coming up, the trajectory. At that point, remember, Delta had only really just started in Australia. We didn't really know what the outcome was in children. We didn't know what was going to happen. And I was just really worried. I think I was just really, really, really concerned. But I don't know if you want to say what happened on that Monday.
On Monday, I was doing geography, and then you called me into your room and said, Tommy, we've got some news. And Harry and Eddie were sitting on your bed, and you just said, Tommy, you've got COVID. And then, yeah.
How did that make you feel?
I don't know, scared.
Yeah, scared because you'd seen everything in the media and heard mum and dad talking about it. And Krispin, I remember, so what you said to me when I went over to you at the forum was that, you and Sarah had been so carefully, taking your PPE off at work and making sure that you did your very best to not bring it home, and then it had entered your home. And, and I remember you describing what really moved me was, cuddling your boys and being with them and being so concerned and bringing it back to your families.
So we had Tommy, and public health made some very reasonable comments about trying to do household PPE and household control, and we tried for that, but frankly it fell apart, and a bit unrealistic, and we ended up actually just giving up on trying to isolate ourselves when Tommy were his parents, and we cuddled you, and Sarah actually. So Tommy got a fever that night. You started getting some high fevers that night and started getting a bit, and we had a bit of a cough and a sore throat.
I developed nauseousness, which was the main thing I had over the 14 days. Yeah. And I developed that on the Monday night.
On the Monday night, and he had a high fever and he had a chill. We had a big shiver and a shake on Monday night, and we were sort of up to that point, before you had the chill, we were going to try and do PPE and stuff, and then we just gave up. And Sarah actually slept in bed with you that night. We were so worried about him. There's no way we were going to sleep in separate rooms or anything. So we just accepted so just to be really clear, Sarah and I didn't get COVID. We're fully vaccinated, and the vaccines were brilliant. But at that point, we just had made a decision that we were going to just keep Tommy as safe as possible. And so Sarah actually slept in bed with you that night. You had some Nurofen or Panadol, and you got off to sleep eventually. We were all just probably worried and things. And then the next day, then obviously we, public health have been in touch. We very luckily were able to stay at home, and I know a lot of the other families in this hospital, in the schools cluster, weren't as lucky as us, so we were able to stay at home, which I thought was it was so good that we could stay at home. It did prolong our quarantine period, but for us that was totally worth it to stay together as a family. And then of course the others, so I went and got a test No, I had a test already on the Monday. I had 9. So the other family members had a test on the Tuesday, and that's when Harry's positive result came back on Tuesday night. Sarah and I both tested negative, and Eddie, our 9-year-old, tested negative as well. And I have to say, probably even when Harry tested positive, that was just a further kick in the guts, and that was probably the hardest bit of all. I just thought, oh, it's going to. At that point, I just assumed it would rip through the whole family. Here was our, a little, as it was getting into younger and younger children as well, and that was a really tough night on a Tuesday night when Harry was diagnosed as well. So we had two children. Harry's results were very, very strongly. Both boys had very, very strong positive results, very high viral load as well. And that was pretty harsh, actually. Yeah, that was a bad night. Harry was quite a lot sicker than Tommy. He had much higher fevers and a cough and a sore throat, and had much more symptoms than Tommy did.
And what would have, can I ask you 2 questions about whether the boys were vaccinated, and at what point do you think you would have felt it appropriate for them to be in hospital in terms of symptoms?
Yeah, I mean, I guess we're lucky that both of us are medical, and Sarah's a paediatrician, so that was a big help. And the Metro North virtual ward were in touch and really communicating really well. So I was confident with keeping Tommy at home. I think you were never, apart from the fever, you were never really too sick. I mean,
I had a sore throat for the first week or so.
Yeah, your fever settled pretty quickly from it. Tommy, it was about 2 or 3 days, wasn't it? You bounced back, and
yeah, I think I got pretty lucky.
Tommy's 13, and he's just sort of switching from being a boy to a teenager, and often has 5 Weet-Bix for breakfast. And I remember by the later in the week, you were back to eating your 5 Weet-Bix in the morning, and I thought, things must be kind of getting back to normal when you're shoving down the Weet-Bix like there's a global shortage of them or something. So
and how old's Harry?
Yeah. Harry's 11 years old, and he was sicker, but I guess opportunity was we could do obs and Sarah could monitor them. We had stethoscopes and all that sort of stuff, and so we kept a close eye on them. And I guess that's one of the privileges of being a healthcare worker and consumer, is you do have that option. And so we monitored closely, but I don't think we ever felt that they were sick enough to need hospital. Now, I have to say, had we not had medical training, I was almost certain that we would have gone to hospital. I don't think we would have just written it out. And that's the psychological aspects of hearing how dangerous Delta is, how high risk it is. We would just want to have them checked out, I imagine. Yeah. Now, so you asked about the vaccination. So
the boys vaccinated.
It unfolded from there, and Tommy made a strong recovery. By the end of the first 2 weeks of isolation, the biggest challenge for the whole thing actually was trying to contain Tommy's teenage energy levels, and you're sort of literally bouncing off the walls by the end of it. And we've got a little outside garden area where I was a bit reluctant to let you go out and eat. Like, even though it's fine, you can go outside in your own garden, but I was a bit worried, and I had this they had to check if any of the neighbours were out, and if they were, then they had to come in, and that was all a bit tense. And accessing the high level trampoline, which is the major play asset that we have in the garden, was pretty controversial. And by the end of it, you were just sick of it and bouncing off the walls. Harry, on the other hand, was much sicker. It took a longer time to recover. And really wasn't right for about 7 weeks, actually. So he had quite prolonged fatigue. He lost quite a bit of weight. His energy levels were low. He missed after he recovered, he then had some ongoing fevers and was quite unwell. We actually ended up taking him to hospital a few times in the 7 weeks, so he took about 7 weeks to recover. And we got some advice for Tommy and Harry, and the advice was that we wouldn't go ahead with vaccination for 6 months after the infection. We actually, Tommy had his first vaccine last Monday, a week ago. How did that go?
Yeah, it's all right. I was scared more than normal ones because it was like a pandemic vaccine, which felt a bit more like high levels, but I was fine. And yeah,
you had a bit of a fever and things the day after.
Then I went to the cricket the day after I had a fever. So
You're back to normal, cheering on Australia the day after that. So yeah, you would expect that a person who's had natural infection is going to have a stronger immune response to the vaccine because they've already got a primed immune system. But it wasn't too bad in you. Yeah, we gave you some Nurofen the first night, I think, and you had a bit of a headache. Or no, anyway, it's bounced back. Harry's obviously not yet ready to receive vaccination. He's still too young, but we'll be going ahead with the 5 to 11-year-old vaccine in January once it's available. So, and following the advice that people who have recovered from COVID should be vaccinated. And I think I just actually read the ATAGI advice just before we came online. It says to wait for up to 6 months. So, I think sort of those around who had the cluster are probably a pretty good time to get vaccinated as things are opening back up again. And from my readings of it, you'd expect people who've had 2 doses of an mRNA vaccine plus natural infection will really have quite spectacular immunity moving forward. It'll be a very, very strong immune response.
Well, that's one benefit of your challenging time, isn't it, Tommy? And Tommy, you and your brother, you have otherwise been well for all of your lives. You don't have any existing conditions, or you're well?
No.
Yeah.
No.
Yeah. So this was new for you, the experience of the health system, something like this. Yeah.
Pretty good. Tommy had mild asthma, but kind of that. So
yeah. I'm really, really keen for us Queenslanders, and the individuals online to be able to learn from you both and your family about your experience. And thank you again for coming on and being so open and generous in sharing that. I'm really keen to start with both of your ideas around how best to care for families and kids and parents who may contract COVID in the next little while, and what worked and what maybe could be improved. And I guess if we could start first with the model of care, or the way that you were looked after, which was at home.
So look, for us, being at home was much better, much easier for us, much more secure, and psychologically way easier as well. I mean, it's the idea of us all being split up was pretty tough. I think would have been a pretty hard thing to do, not to be together for it. So we were admitted to the Metro North virtual ward. We each had a daily or twice daily call from a nurse and a call from a doctor and so forth. They were doing a great job under really difficult circumstances, but were clearly overwhelmed with this sudden huge spike in work. And I think, one of the challenges is providing bespoke individual care, but to hundreds and hundreds, or potentially as things open up, thousands of people at once is really, really difficult. So probably, what do you think? You interacted with the virtual ward quite a lot. How did you find it?
I like the virtual ward. It was nice to just have someone else to talk to. Yeah, but
checking up on you mean?
Yeah, and it was fun ranking my symptoms.
Oh, you had to rate your symptoms every day. Yeah,
that was pretty fun.
Yeah,
but yeah.
I think, look, for us, I know Sarah found that, my wife found that quite traumatic, and the sort of the amount of information we got was pretty low. So I think it just understandably, given how new it was, we were actually amongst the first families in Queensland ever to get COVID. When you feel like sometimes you feel like your luck's down, but I worked out that 99.98% of Queenslanders hadn't had COVID by the time Tommy was diagnosed with it. So it was all a bit new, but I think the written information really helped. Everyone virtually, most people have access to smartphones and to email now. So just emailing really good information, things like what to look out for, when to escalate to hospital. I see there's some chat about that as well, and when not to escalate to hospital, particularly questions about what happens next, like, am I infective? What's all about long COVID or post-COVID symptoms, and particularly some advice given to people with COVID about vaccination so that you know what to do and what to expect. I think that was sort of, we had to use network and connections to try and actually get that information. And I imagine that would have been very difficult for people who aren't in the system to navigate. So assistance navigating the system would really, really help. I think information about where to escalate to for prolonged symptoms would have really helped as well. And if it's too hard, I understand it's probably pretty hard to get an individual doctor patient phone call for all of this. So just write it down in fact sheets and information sheets and email it to us, which worked really, really well. The quarantine notices, again, public health, I think, had 17,000 people in quarantine at that point. So it was pretty hard, but that was pretty scattered, shall we say. I think Eddie, our 9-year-old, I think got 5 different quarantine notices with 5 different discharge dates on it. And one of you never got an isolation or quarantine order at all, actually, I think. Again, I'm not having a go at Queensland Health. It was an incredibly difficult time, yet we are, we're all individuals in this who need information. And I think if you're going to serve a quarantine notice that includes up to imprisonment for non-adherence, you've got to have some robust systems around it. You just have to find a way, even if they're more generic. Or I think some other states are actually getting people to do their own quarantine notices. That would have been better for us. At least we could have had a bit more certainty about the dates that way. So yeah, there are some challenges which I think we could switch around the communications a bit that way.
Yeah. I think Understand information will be coming out officially this week, but the way that we anticipate people will be looked after with COVID moving forward in Queensland will be, there'll be some people like your family, but they would be people who might have more complexities but still safe to stay at home. And then there'll be people being looked after by their GP or another GP from the community in their home, and then those that are unwell and need to be looked after in hospital. So how could you imagine your family's experience might have been different if you'd have had, say, your family GP providing that ongoing care across that 2 weeks and beyond?
Oh, look, I think that would have helped a lot. I think, as a point of entry into the system, and someone just who knows how to navigate the health system in Queensland would have helped. Some more specific advice about either about the vaccination question, or at least where to go to get that specific advice would have been good. What else was there? I guess, again, we ended up presenting to the emergency department when Harry was sick with his long COVID symptoms. We don't want people to come to an emergency department for long COVID. We need the system like that. That would have been ideal for our GP to pick us up at that point. We should have maybe, had we followed up through the GP in a referral pathway, we don't have to fill up the emergency department with something which frankly isn't. It's serious, but it's not an emergency insofar as it has to be seen at like 10 o'clock at night. So system redesign would help there to push long COVID to primary care, where GPs are fantastically equipped to deal with it. I think GPs would be ideal to follow that up. So that might be another change or approach. We rang our GP a few times. And the other thing, when there's nothing official provided, all these informal networks of care spring up. So there was a massive sort of network between all the parents in the school, and there's a range of medical specialists and physios and OTs and a psychiatrist and all that sort of stuff in the schools network, and that was really helpful. And then of course the GPs and the primary care sprung into action anyway, like that, but it was all sort of this informal sort of fifth column of assistance, if you like. So.
And you'll both be pleased to know, I'm sure, that there is now a raft of information and services available for people with COVID as a result of the New South Wales and Victorian outbreaks that are being drawn on and co-designed here with consumers and clinicians in Queensland. And again, hopefully they'll be being released this week. And that will include, as you say, written information, a diary, for people to be able to track their symptoms. There's some on the RACGP website at the moment, but importantly, some information around how people can prepare, which I'll come to in a minute. But just before I do, you mentioned a psychiatrist. In terms of social and emotional well-being and supports, what was that like from the community?
That's a good question. So, one of the upshots of us being at home was we spent a very, very, very long time in quarantine. So we had the 14 days of isolation for Tommy, and then Harry was 2 days behind by the time it was all sorted out. So that was the sort of first 16 days. We had a series of tests, and obviously if any of those for me, Sarah or Eddie become positive, that would have reset that clock again. But so anyway, so we got out to day 16, and at that point, that's when our 14 days of quarantine started. So I was in isolation for 30 days. In quarantine for 30 days, and Sarah and Eddie, who hadn't been out on the Saturday, were in for 31 days. And that's a really long time. It's really, really long. And I think again, we're lucky. We're so lucky we're at home. We're fine. It must be awful if you're a casual worker and your income stops, because we had, sick leave and great support from our employers at that point and things, but it was still tough. It's just frustrating and annoying. And I think each of us sort of had a bad day. I remember, Eddie had a bad day when he realized his little junior soccer team was playing.
Eddie had an awful 2 weeks when me and Harry were out.
Yeah.
We were going because we were going to our cousins and whatnot.
Yeah.
And he had to sit at home.
Yeah.
And it's unfair because it was us that got the virus.
Yeah.
But then he gets yeah.
Extra quarantine at the end. So he got pretty frustrated. And there was that Saturday when his junior soccer team was playing and he couldn't join in, and that was pretty upsetting. And then I just had one really, really bad day. I just got really frustrated with it all. I'm a bit sick of it about 3 weeks into it. I had it. I was sick of it. I exercise a lot. I usually go for a run almost every day, and I hadn't been for a run. I put 3 kilos on. I've been eating too much food. I mean, you discover all the home delivery services, and Dan Murphy's home delivery is great up to a point, but can start to become a bit of a problem as well. And I just kind of cracked it about 3 weeks, and I had one really bad day. It was a beautiful August wintry Queensland day, and all my friends were out doing all these great things. And then Sarah had her bad weekend as well. After we had our final negative tests, there was nothing else to do, but we still had to do 2 more days of quarantine, even with those negative tests. And she just couldn't see the point of it and got really, really furious and cranky. And it was, any tense. Yeah. So look, we were okay. The community were fantastic. I mean, this is the other thing that Queenslanders will be really good at doing, is just helping out. We were almost overwhelmed by generosity. We had little parcels. There was one, we live very close to the boys' primary school, and there was one of the school mums just turned up every morning. There were fresh coffees on our front step, which was just so nice, because it's ridiculous, but it's those little things that you really miss. So the groceries are all fine. Woolworths online shopping, that's all fine. And actually, one other tip is your local convenience store or whatever, even if they don't officially have home delivery, they were so nice. The Barden Shed, big shout out to the Barden Shed, who just did home deliveries of produce for us anyway. And we just rang them and they just said, yeah, of course we'll help out. So, and it's just for helping people who are in quarantine, that is made such a massive difference. And it's not that you don't have to go and buy like a $500 food platter from an expensive deli. It's just the milk, the bread, the toast, just the really mundane stuff and the fresh produce that made a huge difference. And we were just constantly finding these lovely little parcels at our front door that people had dropped off for us, which was really lovely. The cheese was a bit of a problem for me. Combine the Dan Murphy's home delivery and the cheese, and I put on 3 kilos. And I mean, actually, my cardiovascular fitness suffered quite badly. I still haven't really got back to my pre-August levels of fitness from sitting around all day watching a lot of Netflix and eating too much cheese.
Well, speaking of next stages, how was it when you all went back to work and back to school? What was that transition like?
Talk about going back to school.
That was scary, actually. Because I was always thinking, what if the doctors have made a mistake and I'm still contagious or something?
You didn't want anyone else to get sick.
Yeah. That's a surprisingly big worry, is about accidentally infecting other people. Early on, a very well-meaning person managed to I put all these barriers out the front of the house, but managed to get through the first barrier all the way to our front door. And I just thought, oh my God, we nearly, what if they had to go into 2 weeks of quarantine because of that? Very luckily, I just had we had that gut feeling on the Saturday. So we stayed at home, and that was Tommy's whole infected period. But our next door neighbours' kids had left their shoes over, and they just came over to collect their shoes, and that was enough to put them in quarantine for 2 weeks. But very luckily, we didn't end up putting a whole lot of other people in in quarantine by a series of very near misses, because that's what you really, really don't want to do, is put other people in quarantine or risk actually infecting or exposing them. But yeah, we were really worried about whether, and with all my medical training and knowledge, and I've released hundreds of people from isolation, we were terrified about that decision being wrong and us accidentally sending Tommy back to school and then putting the whole school into another lockdown or something, even though it was all logical and rational. There's all these sort of the non-logical part of your brain that your class had been very badly hit, hadn't they? So you were one of almost half the people in your...
Exactly 50 plus a teacher.
50% of your class had COVID. So it was a pretty... How was the feeling in the classroom when you first went back?
It was alright.
All right. Yeah, I guess we're all sort of on chatting to each other and WhatsApping and stuff because we all kind of knew each other. So, but yeah, and some families took quite a long time to come back to school, didn't they?
There was one boy in my class didn't come back until like even 3 days after you guys had finished.
Yeah. So he stayed out another
week
or two. Yeah. That first day, you were pretty teary. We had this funny situation where Tommy was allowed back out in the community, but Sarah and I weren't. So we were relying on uncles and aunts and cousins and neighbours to do the school drop-offs and pickups and that sort of stuff. And
Uncle
that was tricky.
fun.
Yeah, Uncle Uber, we called it. That's right.
So you acknowledged that you were really fortunate in having clinical backgrounds, being able to work from home. I'm sure that on your mind, as on all of our minds, you've been thinking about populations and groups in our community who are more vulnerable to contracting COVID, but also may have less supports to be able to cope with being in quarantine and being unwell. What have the learnings been that you've been thinking about for, say, our rural and remote communities, First Nations communities, particularly for us and our audience, families of either adults or children with vulnerabilities? What do you think that they can do to learn from your family's experience and prepare?
Yeah. That's a really good question. I think so. Some of the things I thought about is, first of all, like, well, obviously, it might be political, but income support, because that's just critical. And not just income support, but even if you've got the income, just like food and drinks, like basic necessities of life. One huge issue is if something breaks when you're in quarantine, it's a really massive issue. So the fridge sputtered to a halt and the light switched off, and I thought, oh, we've lost our fridge. That would actually be a disaster, because then you can't keep any cool food. And luckily, I'm like the world's worst DIY, but I did manage to fix it, and it was only something minor. But support with household maintenance and a plan for if you got something went wrong with it, you needed a repair, or the hot water went out, or something like that. And another one was, bizarrely, Sarah nearly broke her nose during it as well. Just she was watching TV and one of the boys got up too quickly and just whacked her in the nose. But like, then we would have had to go into the hospital with that whole overlay of quarantine and all of that sort of hassle and stuff like that. And that was really awful. So I planned about how you access medical care whilst in quarantine would have been, really useful. And frankly, I suspect a lot of people are just not going to access care for the 2 weeks or more that they're in quarantine, which is risky, obviously, really dangerous. We want people to get regular health care. In terms of, so I sort of mentioned income. I think cultural and linguistically appropriate support in language is really important. And again, it's not going to be possible to have every language group represented on the phone. So just write it down and then utilize the peer-to-peer networks, mobilize an army of recovered people to talk through like what we're doing now, and just mobilize that community with good quality information to do it themselves. And I think, primary care could work really well with that as well. But just don't leave. I think the riskiest thing is saying it's all too hard to get language diverse and culturally diverse information. So just leaving a vacuum out there means that then what you do is you just fill it up with Facebook and social media instead. And frankly, the quality of the information is just not good out there. Like the social media information is 50-50, whether it's correct or not.
Yep, absolutely. And I am pleased from my knowledge of the models and the information to come to support Queenslanders. There's a lot of information. There'll be a lot of contact from clinicians, from wraparound supports, and also that written information in languages, but also some preparedness plans, which is really exciting. So similar to the idea of storm planning, templates for people to use now to, as you say, be able to document, who their care providers are, who do they care for, who can care for them. Importantly, if you and Sarah had contracted COVID and been very unwell, who would have looked after your boys? That forward planning. So we're hoping that people will have the opportunity to be able to do that planning. I think you might have just frozen for me, Krispin. Can you and Tommy hear me? Oh, I think we've just got a poll up at the moment for those of you that are still online and still with us. We would really love your feedback. To hear from your enjoyment of this session, what you've learned, maybe some questions that you still have. We'd really, really love to hear from you. We're hoping to have another session next week, fingers crossed, hopefully with a focus on rural and remote, but we will let you know. If you're a member of our network, we'll be sharing the link. We'll also be sharing a link via the follow-up email to this and also on Facebook. So it looks like we might have lost Tommy and Krispin to internet gremlins, but we're really, really grateful for their sharing today of their family's experience of living with COVID. We need to share the experiences of consumers from a diverse range of backgrounds so that you can all be as prepared as possible. And we are hoping to be able to draw on some learnings from people in New South Wales and Victoria about how they have lived with COVID. So thank you all so much for joining us today, and we will look forward to seeing you soon.